Glad to have you join us on Sound Health this week on Lagos Television. I am Olasumbo Murupe. This week, we are looking at mumps in children and unusual swelling on faces of children. My guest is on standby. You get to know more about this condition. Stay tuned. The conversation begins after this break. Is still Sound Health on Lagos Television. Joining us via Zoom this evening is consultant pediatrician Dr. Olufunmilola Akinola. She is a consultant pediatrician with St. Ives Specialist Hospital, and she is going to tell us what we need to know about mumps. Good evening, Dr. Akinola, and thanks for joining us.
Good evening, viewers. I'm happy to be with you this evening.
All right, Dr. Akinola, oftentimes we see an unusual swelling on faces of children. Tell us, what exactly is this condition? Why do people call it mumps?
Thank you very much. When you notice this bilateral unusual swelling in the face of the children, it's usually caused by mumps. And mumps is a very contagious viral illness that affects the pair of salivary glands in front of the ears, which are called the parotid glands. It's most usually recognizable by painful swelling on the side of the face, under the ears. And it is usually caused by a viral infection, and caused by a virus known as paramyxin virus, which is also described as mumps virus.
Okay, does this condition just happen in children, or is it as a result of not vaccinating and seeing this set of children? And tell us, apart from, okay, let's start with that. Let us know what causes this parotid gland, why it is being affected.
The mumps virus have this predilection to affect the parotids and also the salivary glands that are located in front of the ear and just below the ear toward the neck of the face. And it's just as I mentioned earlier, it's caused by mumps virus, which spread from one child to another through direct contact with someone that is infected with the disease. And it is spread from nose, and the throat of the infected person. When that person coughs or sneezes into the air, then it is transmitted through the air to another person. And through that, it affects the parotid and the salivary glands, causing swelling, and also associated with pain. And usually affects most children that are not vaccinated between the age of 2 and 5 years. So it's usually commonly affected unvaccinated children between the age of 2 and 5 years.
Okay, apart from swelling of the face now and painfulness on this spot, what are the other symptoms mothers or caregivers must look out for?
In most cases,
Because
typically,
it
we
takes
usually
time before
have
it swells.
mild pain in the salivary glands in front of the neck or right in front of the hair. Uh, Also affect the parotid glands, and when you have mumps, either of these glands may be swollen and also sore. Then other part of the body that can also affect includes the testicle. It can cause testicular pain. It's also associated with fever. Then some of them that may be able to explain will tell you that they're having headache. They also have muscle ache. They may complain of tiredness, and there is associated loss of appetite. But the most symptoms and signs that usually gives mumps away is the pain and swelling that you notice on the face when it affects the salivary glands and the parotid glands.
Okay, Dr. Akinola, does this mean mumps is highly contagious? Because you said it is spread through tiny droplets in the air.
Yes, I mentioned it earlier. It is a very contagious viral illness, which is spread through air droplets. When someone that carries the virus sneezes or cough into the air, it releases the virus into the air, and through that it spread from one person to another. When you get in contact with the virus, that has been released into the air by the infected person. So it's easily spread from one child to another and from one person to another. That is why we said it is very contagious.
Have we seen children that have been fully vaccinated and still come down with mumps? Are there other risk factors?
The most known risk factor is when these children are not vaccinated. However, if a vaccinated child eventually come down with mumps, it's going to be um, a very mild uh, form of the disease.
Is this condition preventable in children?
Yes, I mentioned it. Yes, it's preventable in children by vaccine, mumps vaccine, and this vaccine is given in associated with other vaccinations such as measles and the rubella virus at the age of 12 and 15 months. That's when you have first dose. Then the second dose can be given at the age of 4 to 5 years.
Okay, before we look at how to prevent the low uptake of vaccination in children, let us look at treatment. Is mumps treatable in children?
Mumps is a viral illness, so you don't have any antibiotics or any medication that you give to a patient to treat mumps in particular. Treatment of mumps is mainly symptomatic, and what you do is when the patient comes, you advise to rest, have plenty of rest. Then also, patient should also take fluids, should take enough fluids to prevent dehydration. You also can give paracetamol or ibuprofen, in accordance to your doctor prescription. And also, what you can do at home is to apply the cold compress or warm pack to the swollen salivary glands to prevent pain. And while you can also apply a cold cloth to the testicle, when you have a testicular pain. But there is no particular medicine or antibiotics that you use to treat mumps because it is a viral illness. So what you do is to treat symptomatically.
All right, so if this condition is left untreated in children, are there complications?
Yes. I mentioned earlier that in most cases, most children that prevent with mumps prevent the mild form of the disease. But however, there are some complications that are associated in severe illness. And one of these is arthritis, which is inflammation of the joint. Then the patient can have what we describe as encephalitis, inflammation of the brain. Then they may have meningitis, which is inflammation of the brain, the meninges, and the spinal cord. There may be orchitis, which is the inflammation of the testicle, and some of them may also have pancreatitis, which is the inflammation of the pancreas. So these are the common complications that are associated with severe cases of mumps, if it is severe enough and it is not treated on time.
Dr. Akinola, because you mentioned that it affects the testicles, will this affect or cause male infertility later on?
When it affects, one of the complications that it can arise is from severe mumps infection is testicular inflammation, which we describe as orchitis. And when the testicle is affected, when you have orchitis, it can it can affect the cells that produce spermatozoa. And if these cells are damaged due to complication arises from mumps inflammation, mumps infection, it can lead to male infertility in future because spermatozoa is important, for a male to be fertile. And if the cells that are producing these sperms are damaged due to mumps infection, it will lead to male infertility.
Okay, over 120 countries have adopted the mumps vaccines, but uptake of immunization is still very low. What advice do you have for parents, key players, as we wrap up now?
What I would advise parents is that they should ensure that their children are vaccinated, and they should also get this vaccine on time when the time comes. In Nigeria, as of now, you get vaccination of mumps through MMR, and this is in association with measles and rubella vaccines. And these are given to our children from the age of 12, 15 months. They should have had their first doses. So I will advise the parents to ensure that these vaccines, are given to their children at that particular age. And also, our government should also support and ensure that these vaccines are available. And as soon as possible, the parents should make sure that their children are vaccinated. Most of the vaccines are available in most of our hospitals, either general or private hospital.
Vaccines are the surest way to prevent your children against the preventable diseases. Dr. Olufumi Lola Akinola, thank you so much for your time and expertise on sound health.
Thank you for having me.
All right, I have been speaking with Dr. Olufumi Lola Akinola, consultant pediatrician with St. Ives Specialist Hospital, and she has been sharing her thoughts and insights on how to prevent children against mumps. Sound Health continues with trending health report from around the world. Please stay tuned. Where we say thank you on today's episode of Sound Health. Mumps, measles, cholera, and other diseases out there are vaccine preventable. You need to protect your child or children against all these diseases. They are safe, free, and harmless. For comments and inquiries, or you have topics you'd like us to treat, please send SMS 3003582 to 6603 or follow us on social media at Lagos Television, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.